Good evening. More than 6,200 cases and climbing. A new report calls Tennessee's fight against COVID-19 positive but fragile tonight.
141 people have lost their lives. 7 of the top 10 counties with coronavirus cases are still right here in the mid-state. Starting this weekend, free testing will expand statewide so that any Tennessean, regardless of symptoms, can be tested. A new report from Vanderbilt University Medical Center says statewide our transmission rate has declined to 1. That means each infected person infects, on average, 1 other person. Experts say as long as the transmission rate stays there, hospitals won't be overwhelmed. While that is good news, doctors say that progress can unravel quickly. In some areas like southern Middle Tennessee and the Cookeville area are battling higher transmission rates. All right, if you have loved ones in a Tennessee nursing home, you probably want to know how well that facility has handled the COVID-19 crisis.
Our News Channel 5 Investigates team has been fighting to get that information for weeks, and tonight the Lee administration is telling Phil Williams it may soon be ready to be more transparent. Phil.
Here at this NHC nursing home in Franklin, we know there was a COVID-19 outbreak, but as to how many people got sick or if any have died, that's information that's being kept from the public.
The nursing home giant would only tell News Channel 5 Investigates that there are 3 residents currently in the facility with COVID-19. They would not say how many were sent to the hospital or how many died. For that, they suggested we ask the health department.
Our contact tracing folks and epidemiologists do know exactly what is in each facility. We do not report that publicly.
So far, State Health Commissioner Lisa Piercy's department has only been willing to list the names of nursing homes with 2 or more cases. They refuse to say how many confirmed cases, or in the case of the Gallatin nursing home, the health department will not even confirm that at least 20 have died, citing federal privacy rules.
The decision that we as family members make to place a loved one in a nursing home is difficult enough.
State Representative John Ray Clemens wonders why the Lee administration doesn't get that families need information about how well nursing home operators are protecting our society's most vulnerable citizens.
Not being able to visit them is an additional stress, and then not knowing what is going on inside the walls of that nursing home and whether your loved one is being properly cared for.
Today, when we pressed again, the health commissioner suggested her department still might end up coming down on the side of transparency.
So we're continuing to work on what we can release, and so I'm hopeful to have additional data points for you in the next few days.
Remember, other states have found it perfectly legal to release this sort of information: how many people are sick in each nursing home, how many people have died. As to why Governor Bill Lee's administration comes to a different conclusion, we can only speculate. Phil Williams, News Channel 5 Investigates.